Practice Test 5. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a vet talking to a pet owner called Toni Davies. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Oh, she's fine overall. I just think it's time I did something about this.
What seems to be the problem?
Well, recently Bubbles has been acting a little bit strangely. When I take her to the park, for example, she'll pick fights with the other dogs just because they're, well, there. She barks so loudly, it's really embarrassing. Then don't get me started about when she sees any males about. She acts really, well, randy. I've had Bubbles since she was a puppy, so I know when something's up.
Remind me how old she is now?
She's 2.
All right, and what are you suspecting?
I don't know. I was reading around on the internet about what happens to a dog when she's in heat, and she's displaying all the usual signs.
Is Bubbles your only pet?
She is. We were considering another, maybe a German Shepherd or a Dachshund, but I don't know if she'll be able to cope with that.
I understand your concerns.
Will she always be like this? Is there something we can do? It's getting to be a right pain. The neighbors have a pit bull, and the other day I caught him leering at her. He got pretty violent. We've got a huge hole in the fence that I'm pretty sure was down to him trying to bash his way through.
Have you ever considered spaying Bubbles?
What's that?
It's abdominal surgery to prevent her from becoming pregnant. The medical term for it is ovariohysterectomy, when both the ovaries and uterus are removed. She'll have a faint scar on her tummy, but other than that, you won't be able to see anything. She'll be much calmer afterwards, and you won't have to worry about annoying or messy heat cycles.
Oh, goodness, no, I wouldn't want to hurt her. Is there any other way?
Don't worry, it's a relatively painless procedure, and it's all done under anesthetic, and it's over within 2 hours. She'd come in, we'd give you the painkillers for her afterwards, too. Plus, an Elizabethan collar to stop her from interfering with the stitches. There are other health benefits, too.
Really? Like what?
Well, for one thing, it'll reduce her risk of contracting breast cancer or a womb infection, which is something that can be fatal. Plus, pregnancy in dogs can be quite a big risk that can produce medical complications. The list is endless, really. I can only imagine that she creates quite a bit of mess around the house when she's in heat.
You've got that right. All of those months we spent getting our house trained, and now this. Okay, I think it's something that I'd like to do. Like you say, there are lots of health benefits, and I'd like Bubbles to live a long time. Plus, I'm sure you've done this plenty of times before.
Oh, absolutely. It's a common procedure.
It sounds like there are a lot of positives, but what about the drawbacks? Will she change at all?
Her metabolism will likely slow down after she's spayed, so you'll need to feed her less and keep up or gradually increase her exercise routine.
Okay. If you think it would help. How soon could we have this done?
As soon as next week. I'll check to see if we have the space. Just make sure she hasn't had anything to eat beforehand. The food could react with the anesthesia and make her feel nauseous.
Okay. And you say it'll all be done within a couple of hours?
Yes.
What about after the procedure? My partner and the kids have got into a routine with Bubbles now. We each take turns to feed her and walk her. Can we just carry on with our normal routines?
Absolutely. The day after the surgery, she can eat normally. One thing I would say, though, you would need to limit her exercise for about a week after the surgery. I'd also keep her indoors for a little while.
Okay. So we just ease her back into the routine?
Right.
Okay. I'll discuss it with my partner, make sure he's okay with it, and then I can call to book in if that's okay.
That's absolutely fine. Take your time. It's a major decision.
Extract 2, questions 13 to 24. You hear a nurse talking to a patient, Jim Knowles, for questions 13 to 24. Complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Jim. How are you feeling today?
I'm all right, Nina, pet. How are you?
I'm having one of those days, I'm afraid. So let's have a look at your chart. Okay, everything looks good. How are you feeling?
Much better today. I think the morphine has started to kick in.
What are you like? You don't need morphine. Jim, you just need to eat a proper meal. What did you have today?
Don't worry, I did eat my daily ration of slop today. I think they call it a hospital roast.
That was for lunch. What about breakfast?
Yes, I had the usual gruel.
Very good. Your vitals are looking better already. Do you remember much about the fall yesterday?
Yes, I do, pet. I've been getting in and out of my Stairmaster without any problems for the last few weeks. I just had slip and tumble is all. Mavis called the ambulance, though, and here we are.
Okay, it looks as though you've sprained your right elbow. There's a little bit of a bruise forming.
Okay.
I'll make sure you get an ice pack for it. Are you in pain anywhere else?
I don't think so.
And your hearing aid seems to be working just fine. How long have you been using a hearing aid?
Around 5 months now. Right around the same time that I started wearing reading glasses, I think. No, actually, I got it before.
Okay, are you near or far-sighted?
I always thought a little of both. What's the one where you can't read things up close so well?
Ah, okay. Yes, it's confirmed in your notes. Hyperopia, it says.
If you say so.
I do. Would you like your glasses now? I can't see them anywhere.
Mavis took them to get the frame changed. They were broken in the fall.
Okay.
Can I ask you, Nina, why all the interest in my feeding habits?
Mainly because of your medical history, Jim. We want to make sure that you're not malnourished. From your file, I can see you had a bout of dependency on drugs.
I did not. I was an alcoholic briefly, but I haven't touched a drop since '08. I swear.
I believe you, Jim. It's just that your condition means that you're at greater risk of developing malnutrition. We want to keep an eye on you is all. We don't want to lose you.
Oh, you are too kind.
Will your wife be coming back today with your glasses?
Not just my glasses. She's bringing Callum and Sophie too.
Your grandchildren?
Yes,
You must miss them.
very much. I can't wait to take them fishing again or to the park. Those are my only hobbies now.
I'm sure they'll be just as excited to see you. Well, if you don't need me for now, I'll go and see if I can find you that ice pack. Try and keep the pressure off your shoulder and arm in general, okay?
Yes, ma'am. Will you come back later to see me before I go to sleep?
Yes, if only to make sure you've had something to eat. You wouldn't want us to get the peg out, would you?
No, that won't be necessary. Just ask them to liven up the menu a little, would you? I don't think I could stomach much more of that slop they call food.
I'll see what I can do. In the meantime, let me fix your pillows. You want to make sure.
That is the end of Part A. Part B. In this part of the test, there are 6 short extracts relating to work of health professionals. 4 questions, 25 to 30. Choose answer A, B, or C, which you think best fits according to the text. Question 25. You hear part of a talk on a medical condition. Now read the question.
There are some really simple exercises and stretches that you can do at home that will help you with your sciatica. These exercises can really help to ease pain in your buttocks, legs, and or feet, as well as help to improve your strength and flexibility. You should aim to do these exercises every day along with other activities like swimming, walking, or yoga. If you are able to do this, you should find that your pain should start to ease within 2 weeks and will usually pass completely in about 4 to 6 weeks. As an aside, you should see a GP if your pain doesn't improve within a few weeks or you find yourself experiencing severe pain while trying any of these exercises. Ready? So the first exercise is the sciatic mobilizing stretch. For this, you would lie on your back and place a small flat pillow or book underneath your head. Bend your knees, keeping your feet straight and hip width apart.
Question 26. You hear part of a GP consultation on asthma. Now read the question.
Okay. Are you alright? How are you?
Not great, not great.
Okay. Had my first asthma attack last night. From what I'm aware, it's quite just an acute attack.
Okay.
But obviously my family are worried and I've been in overnight.
Yes.
I think I'm going home in a couple of hours, but I've just realised I actually don't know anything about asthma.
Okay.
And I've heard people can die from it, and I just wouldn't have any clue what brings it on, how I can treat it.
Okay.
So I just need to know.
That's fine. I know it can be very, very scary if you've had your first one. What I'll say is asthma is an autoimmune disease. So what it is your immune system, when you get stressed, or if you breathe in contaminants, or if you feel that tightening in your chest, which you felt, and it can feel like restrictive and you feel like you're not going to be able to breathe. It does that because it feels like it's being attacked and it protects itself. What you need to do is we need to get you an inhaler, and that will be a preventative inhaler plus one that will help you as well if you have an attack or you feel tight in your chest or you're wheezing. So we use Ventolin for that.
Question 27. You hear a hospital committee discussing new plans. Now read the question.
This new wing is going to speed up access to treatment for seriously ill patients.
After all the consultations, public polls, protests, meetings and a 28 million investment, I'm glad to hear it.
Don't worry, every pound was well spent. Over 100 senior doctors were consulted in the planning for this. Senior GPs, health and social care experts, and members of the public were also drafted in.
Are you talking about the new wing? I'm so excited! Especially about the new booked care sites, where beds will be protected for operations that are planned. That way, procedures won't be cancelled because of emergency admissions.
Speaking of emergency admissions, the new space means that our emergency care centre is going to double in size. Given that it is open 24 hours a day, we'll be able to almost quadruple the number of patients we see on a daily basis. This town will have more than 80% of its patients go to the same hospital for all their care needs. How are you not more excited by this?
I just hope that with all this attention on the emergency aspect of what we do, other departments aren't impacted by these changes at all.
Question 26. You hear a vet consultation. Now read the question.
I'm going to show you how to vaccinate your puppy at home. Your puppy powder pack will contain the following: needle and syringe, liquid vial and powder vial in 2 separate and tiny containers. To start the process, tighten the needle on your syringe and insert it into the liquid vial and withdraw all the liquid. Inject the liquid into the second vial that contains the freeze-dry or powdered vaccine. Remove the needle from the liquid vial and shake the powdered vial for a few seconds to mix the liquid and powder well. Then insert the needle back into the powdered vial and withdraw the entire mixed content. You are now ready to give the vaccine, which should be done subcutaneously. This is to say, beneath the skin and not into a muscle. It's easy and safe, and your puppy will hardly notice the injection.
Question 29. You hear a doctor talking to a trainee. Now read the question.
Would you assist me with a patient?
Of course, Doctor, Mr. Williamson. How can I help?
The patient is a 24-year-old male who has come in following a rather nasty motorcycle accident. He has sustained fractures to his spine, fractures to his ribs, and a laceration to his liver. I'd say that the latter of the three appears to be the most critical. Would you agree?
I think so.
We're pre-op, and I'm trying to decide on what procedure would be the most appropriate, so it's very important that we're as accurate as possible. Can you assist?
Are you sure you wouldn't rather a registrar?
Yes, I'm sure, Jessica. The patient needs surgery, so it would also be a good opportunity for you to assist with the procedure afterwards, once we've decided on the best course of action.
OK, thank you.
Are you ready?
Question 30. You hear part of an episode of a medical TV show called Bowlby City. Now read the question.
Has anyone seen Laura today? I've been trying to track her down to see why I don't have any shifts this month. What's the matter? Why has everyone gone so quiet?
Nina, can I have a word? In private?
Of course, Alan. What's going on?
Please take a seat. Nina, I'm sorry to be the one to tell you this, but one of your patients, Mr. Williams, died from hypoglycemia last night. He hadn't been given his medication on time. There's an investigation happening, and unfortunately, because he was under your care, we've been asked to suspend you until the investigation is finished.
Oh no. I'm so sorry.
His family have been notified, and I'm sorry too. This should be coming from Laura, but she's otherwise engaged, and I didn't want you to be in the dark.
I appreciate that. Thank you, Alan.
It's the least I could do. You're a great nurse, and I'm sure this will all blow over. I'm supposed to take your ID card and keys and escort you from the premises now. I'd rather not.
It's okay.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear a healthcare practitioner talking about aspects of their work. For questions 31 to 42, choose answer A, B or C, which you think best fits according to the text. Extract 1, questions 31 to 36. You hear a doctor, Lily Sampson, in an interview about her work on managing deafness in children. You now have 90 seconds to read questions 31 to 36.
Welcome to the Health Matters podcast. Joining me today is Dr. Lily Sampson, who is an ENT specialist. Dr. Sampson, it's a pleasure to have you on today's podcast.
Thank you for having me.
So today you're going to be talking to us about deafness, is that right?
That's right, Ricky. As you know, deafness is the loss of hearing that can be partial or complete. Deafness has affected many people in the world today, and it occurs as one advances in age. In the United States of America, almost 25% of people aged 55 and 65 have suffered deafness or having some problems with hearing. About 1 out of 2 older adults more than 65 years of age have some hearing loss.
What causes deafness?
Good question. It can be the result of several factors, such as congenital abnormalities of the ear, a loud sound accident that affects the ear cochlea, aging, as well as bacterial infection like chronic otitis media. It can also be due to cerumen impaction, which may prevent one from hearing.
Cerumen impaction being?
The accumulation of earwax.
Ah, gotcha. Would this be something that may cause partial deafness, for example?
Possibly. There are many types of deafness, which, as you know, can be partial or complete. There are 3 main types of the condition. Firstly, there is conductive hearing loss, which is associated with problems within the ear canal, eardrum, and middle ear structures when they are unable to conduct sound. It can be caused by tumours or compacted earwax. Secondly, there is sensory neural deafness that occurs when the ear structures are able to conduct sound, but the auditory nerves do not function to transmit the sounds to the brain for interpretation. It can be caused by facial nerve paralysis, meningitis, congenital malformations of ear structures, as well as cytomegalovirus. Lastly, a mixed hearing loss involves both the conductive and sensory neural cases. All the 3 types can either be partial deafness, where the patient is able to hear some sounds, or complete, where there is a complete loss of hearing.
I think most people who are deaf are born that way, but they can also develop it, right?
That's right, and deafness presents in a person with several symptoms like tinnitus. The person may start needing to tune their radio and television volumes to be higher, for example, without really knowing why. Most of such patients avoid social groups and dislike involving themselves in conversation with people as a result. They may feel isolated. In school-age children, the class performance reduces since they barely hear what's being taught in class. They may also have difficulty in hearing and differentiating consonants.
That's really rough, especially the part about them not knowing why it's happening to them. Is there any way to diagnose that it is deafness and not, well, something else?
Yes, hearing loss can be diagnosed using different diagnostic tests. I may use an otoscope to view the inner ear structure via the ear canal, for example. Through otoscopy, one is able to identify where the problem is, and especially structural defects of the inner ear and wax. Rhine and Weber's test can also be done using the tuning fork to detect the type of hearing loss a patient is having. In Rhine's test, a tuning fork is hit and then placed on the mastoid bone or next to the ear canal in order to compare the bone and the air conduction. The test is positive for conductive hearing loss if the patient hears longer on the mastoid bone than is next to the ear canal. Weber's test determines the sensory neural deafness. The tuning fork is placed on the middle of the head to detect which ear hears the best and which one does not. Also, imaging techniques like X-rays, CT scans and MRIs can be used to show detailed pictures of the structure of the internal ear. The patient can also be called out or talked to loudly during the diagnosis to see how far they can hear from before the other tests are considered. Audiometry is also another important test that is mostly used to detect function of the auditory brainstem, specifically in children, using the opocaustic electrical machine.
Can deafness be treated, Dr. Sampson?
In a word, yes. The first priority of treating deafness is treating underlying medical illnesses like otitis media using broad-spectrum antibiotics. Associated disease like meningitis, shingles, and cytomegalovirus should also be treated. Surgical treatment for ear tumours can also help in treating hearing loss. Cochlear transplantation can also be done, especially in children who have a cytomegalovirus infection of the cochlea.
Wow, thank goodness for ENTs like you.
Don't get me wrong, nurses play their part too. In fact, nursing care is very important to all deaf patients and their families. The nurse would usually perform a comprehensive history taking to know the cause of the hearing loss. The patient and the family members should be taught on the presenting symptoms of deafness as well as the different types. They should be encouraged to go to any ear, eye, nose and throat clinic if their symptoms persist as well as go for regular checkups. Care of the ear is also very important. For example, the parents of the children with otitis media should be taught on how to clean their child's ear. Those who work in areas where there are loud noises should be taught on the importance of wearing ear protective gear during work. They should be advised on seeking training on sign language so they can be able to communicate with their family members once more, as well as continue with their activities of daily living.
Extract 2, questions 37 to 42. You hear an interview with Dr. Kyla Lee discussing a tropical disease. You now have 90 seconds to read questions 37 to 42.
My name is Dr. Kyler Lee, and I'm a medical doctor with a research interest in tropical diseases. Ascariasis is a condition that does not receive much attention, and I thought that your listeners would enjoy discovering more about the condition. As you all may know, ascariasis is the most common helminthic infection, with an estimated worldwide prevalence of 804 million cases in 2013. Usually asymptomatic, ascariasis is most prevalent in children of tropical and developing countries, where they are perpetuated by contamination of soil by human feces or use of untreated feces as fertilizer. For more information on ascariasis in children, see the Medscape article, Pediatric Ascariasis. Symptomatic ascariasis may manifest as growth retardation, pneumonitis, intestinal obstruction, or hepatobiliary and pancreatic injury. Ascariasis may exist as a zoonotic infection associated with pigs and the use of hog manure, but in most endemic areas, it is most likely transmitted from person to person. Ascaris lumbricoides is the largest of the common nematodes, or roundworms, that infect humans. Adult lumbricoides are white or yellow and 15 to 35 centimeters long. See first image below. They live 10 to 24 months in the jejunum and middle ileum of the intestine. Each day, female lumbricoides produce 240,000 eggs. See second image below, which are fertilized by nearby male worms. A Chinese study showed that 45% of infected persons shed only fertilized eggs, 40% shed fertilized and unfertilized eggs, and 20% shed only unfertilized eggs. Unfertilized eggs accounted for only 6 to 9% of eggs shed. Fertilized eggs released into favorable soil may become infectious within 5 to 10 days. Eggs may remain viable in soil for up to 17 months. Infection occurs through soil contamination of hands or food, ingestion, and the subsequent hatching of eggs in the small intestine. Second stage larvae pass through the intestinal wall and migrate through the portal system to the liver and then the lungs. A significant exposure may produce subsequent pneumonia and eosinophilia. Symptoms of pneumonitis include wheezing, dyspnea, non-productive cough, hemoptysis, and fever. Larvae are expectorated and swallowed, eventually reaching the jejunum, where they mature into adults in approximately 65 days. Adult worms feed on digestion products of the host. Children with a marginal diet may be susceptible to protein, caloric, or vitamin A deficiency, resulting in retarded growth and increased susceptibility to infectious diseases, such as malaria. Large entangled worms may cause intestinal, usually ileo, common duct, pancreatic, or appendical obstruction. Mean worm burden varies from more than 16 to 4 and appears related to host factors, particularly age, geophagy, and immunity. Worms do not multiply for the host. For infection to persist beyond the 2-year maximum lifespan of the worms, re-exposure must occur. Some children appear to become very heavily infested, probably from multiple cumulative exposures over time and/or relative immunodeficiency. Ascaris lumbricoidesuum, a swine nematode, has been thought responsible for zoonotic infection. Distinguishing this worm from a lumbricoides is difficult, as it differs by only 6 or 1.3% nucleotides in the first internal transcribed spacer, ITS-1, and by 3 to 4% in the mitochondrial genome sequence. Aisuum appears to be responsible for most ascariasis cases in well-developed countries with excellent sanitation, e.g. Denmark, United States, UK. In this setting, infected persons have a low worm burden and may present with only cough, acute eosinophilia, or eosinophilic liver lesions visible on CT scans. However, a molecular genetic study from China casts doubt that infections in pigs are the cause of most human infection. Immediate cure rates after single-dose albendazole in South Africa were 95%, with egg reduction rates of more than 99%. Most treated patients become reinfected within months unless they are relocated to an area of significantly improved sanitation. Early symptoms of ascariasis during the initial lung migration, first 10 to 14 days after ingestion, include cough, dyspnea, wheezing, urticaria, hemoptysis, and chest pain. This may be seasonal after rains in some countries, such as Saudi Arabia. Returning travelers could also present with Loeffler syndrome or eosinophilic pneumonia if exposed in a high-risk environment. Abdominal pain, distension, colic, nausea, anorexia, and intermittent diarrhea may be manifestations or partial or complete intestinal obstruction by adult worms. Jaundice, nausea, vomiting, fever, and severe or radiating abdominal pain may suggest cholangitis, pancreatitis, hepatic abscess, or appendicitis. Complications of ascariasis are related to worm burden and location of the relatively large nematode. They include acute abdomen, upper GI bleeding, small bowel obstruction, volvulus and intussusception, peritonitis, biliary colic, acute cholecystitis, acute pancreatitis, acute cholangitis, and hepatic abscess. As such, ascariasis could be considered a potential cause of surgical emergency in endemic areas.
That is the end of Part C. You now have 2 minutes to check your work.